Next, we're going to look at the clinical chart component of the software. Now, first we have to pick a patient. We can either pick a patient here from our schedule. We can go up here to find a patient like we showed during a previous video, or we can go to one of our recently accessed patients in case we have a need to look at somebody that we've been to recently. So I'm just going to click here on Test AFP Dottie's chart, her name, and it'll bring up her chart. This is the view that you should see, and you'll see that the chart icon is highlighted here. We're looking at the patient's chart. In general, the chart categorizes information for review. The chart doesn't, for the most part, allow you to add information in the chart view. Most of that is done either through document or orders. There are some exceptions to that, and I will point those out as we move forward. Now we landed here in the summary component of the chart, and the summary has these categories of information you'll see in blue, these titles of information. And what it does is pulls together information from other parts of the chart, information that you or others have put into the chart, and pulls those together. Each category here is called a widget. So we have a PFSH widget. We have a medical summary widget, documents widget, so it basically pulls in that information by category. Now the great thing about widgets are you have control over those, so if you don't feel like you have a need for some of them, you would like to remove some, reorder them, you have capability to do that, and I'll show you how to do that in just a second here. The other thing is if you have an underline from the title, generally that means that it'll open an overlay for you to either see more information or give more detail around that widget. So here under PFSH we see we have a column of information. If we click that underlined title, it just, in this case, just brings a little more detail and takes up some more of the screen, but you can scroll through and see. Again, we can't interact with this. I can't add to anything in the PFSH. It's just a more comprehensive view. Click out of the box to make that go away, and all the rest of them work that way. And you have these two columns here that are widgets. Now in this third column, which is smaller, this column is actually called the reference panel. And what's great about the reference panel is that information follows you throughout the chart. So if you want to look at lab values, you can go down here, you can see the lab values and refer to them whenever you're making your clinical decisions later on, or when you're documenting. You can refer to those later. One of the unique things about the reference panel is Meditech has made the top 4 widgets in the reference panel set in place. So allergies, problems, medications, and outstanding orders. You cannot move those in order. Other widgets on that list you can move around. So if I wanted vitals to be lower, I could move those around, but I can't really these. They've done that because they want you to those to always be on the widget panel or reference panel and always be available for you to see. The other thing that's different about those 4 is whenever you click the underline there, whereas when we're in the chart and other widgets, even in the reference panel, if you click that underline, you get just a popover that has information. We do still get the popover with information with the others, but on those top 4, we also get to have some kind of interaction. So here, if I click the popover for allergies and adverse reactions, I can actually add an allergy or interaction. Same thing with problems. I can click the problem list and it'll give me my problem list, but I can also add to and manage my problem list directly from the reference panel. So that's a little different. Now to control the widgets that you see both in the chart section and on the reference panel, if we go here to More and choose our ambulatory preferences, and we're going to look at, remember we were in the chart, so we look at the chart, and here you have your left summary panel, your right summary panel, and then here's your reference panel. And again, you can delete, add, whatever you'd like. So let's say this common screening, I don't really think I need that one. I want to clear up my screen. I can X that out and it'll go away. Maybe I want to move lab results further up. I want to see those before I see my PFSH. I can do that. Over here in the reference pane, you notice those top four, we can't manipulate those top four, but if I get here to vitals, I get my red X, I can take it away, or I can move my vitals further down or up on the list, just not beyond that fifth spot. I wanted to go back and focus on two more widgets that have the capacity to add information that we didn't talk about before. First here is the immunizations, and this one's going to come up a lot. So if you have a patient who has received an immunization and you've gotten the information from maybe CVS or they gave it to you in a medical record or whatever, the way that you do that, the way that you add that information is to go here to the immunization widget. And you'll see here what says new immunization. We have a list here that's brought up, so we could pick a new one that we were going to add, maybe a Hep B. And you have it's asking to give you the administered date. So let's say it was 1/1/2015. Was the vaccine given? Yes. And then the source of information. So maybe we could say then medical records. That's how you would go through and record if you got information from the patient and you wanted to record that information in their immunization history. You do that from the immunization widget. Just click Save. And you'll see now that it's updated our immunizations with the hepatitis B vaccine on 1/1/2015. Another area where we can add information is here under the pharmacy widget. So this patient already has a preferred pharmacy listed here, the CVS, the 71st and Benford. If we wanted to add a new one, we just would pick it from the list, say Associates Pharmacy here, and then you can indicate which one is preferred, which will be the first one that new prescriptions are sent to whenever they're submitted. Just a couple more. That was just a couple more areas within the chart summary that I wanted to point out that you do have the ability to input information and it is valuable. Moving on to the activity panel. First we'll see, we're here on the summary panel and you notice that the tabs are missing where we can jump from one section to the other. Meditech has determined to do this to save screen real estate, so I see just a little bit more. In order to get those tabs back, I can either keep scrolling up, or if I just hit this icon to the left of summary, it'll bring those back down and I can move on to my activity panel. The activity tab is a chronological listing of all of your patient's activity, including visit notes, your task workload messages, some administrative documents. You should generally see that there is a document or a message or some kind of icon next to each office visit listed or each interaction listed. We are, in the test system now, so there's a lot of documents that aren't getting completed all the way through. But generally speaking, you should be able to just click and see. So if I wanted to see the documentation for this office visit here on March 31st, I could click on it. Here it is. I can print it. I can move on to the next document here. Or if I want to just close this out, if I've seen what I need to see and I close out again, I just click outside of that blue box and it'll go away. The little email icon here, that's your task and workload messages, so that means there's been a message in the system generated attached to this patient. Probably much like you're used to today, all those are automatically tracked within the system. This is an incomplete uncollected order, so there's been a message generated automatically indicating that this patient's A1C was not collected. You can update that information, so if you have new information or you contacted the patient to try to get them to get that lab done or whatever, you could just click the update button, or again, just click out to go outside of it. We do have the ability to filter the information that we see a little bit. So you see we have all activity during the past 1 year for all categories. Everything in blue means that it has some kind of interaction that you can do with it. So if we click here on 1 year, you'll see that we have different options for time. We can't unfortunately shrink less than 1 year, but we can view out more years. And we don't really have the ability to do time frame yet, but I know that we have that as an enhancement that we have requested, so that if you know that it happened sometime in the last, maybe in 2012, you know it happened. If you click just 2012, you could be able to filter down to just that year. The other thing that we can do here is we can look at different categories, based on general documents, microbiology, blood bank reports. We can also look at patient messages. So if we wanted to just see those messages, just see those tasks that have been generated, you can click on patient messages and it will show you just the messages that have happened. And we can again click on them and see detail like we did before. This all activity, there's not a whole lot of, I think, interaction that's going to be useful for most people, but if you did happen to know that maybe your patient was seeing the ED and you wanted to see just the emergency report, you wanted to filter just to the activity in the emergency department, you could click here and be able to filter down to just what happened in the emergency department. Next up is our diagnostic tab. Now, I don't particularly find diagnostic tab to be that helpful. There are more helpful components within the system where you can view diagnostic information that I think will be more valuable to you. But if you do like this, again, chronological listing of all of the diagnostics, lab, x-ray, ultrasound, MRI, all those diagnostics all in one place, you can go here within the diagnostic tab. And again, you have the documents where you can view the report, or you can view images, or you can view the lab information. What I think is maybe not that helpful is that you have to open each one to see each one rather than having it pull in that information like it maybe does over here in the lab results or in other components of the system. But I'll leave that up to you. I do want to note here, this is the first time I've seen this for us. This green check mark indicates that that is something that you personally have already viewed. That's been viewed by you. So it's not new information, so it'll be a good indicator that that information has been viewed. Next up is our medications tab. Again, the medications component of the chart is a view only, so you can view medications. You can see prescriptions. You can see medications that were administered in the office. You can see what the patient reported that they're taking, and also discontinued medications from this list. You cannot reconcile or any other component or any other activity from this chart. If you click here on View, you can view different time periods, which is kind of nice. If you wanted to view a snapshot in time, so if you wanted to see what they were on this time last year, you can look at a snapshot and it'll show you their medications on that day. You can also look at a time period, so what kind of medications were they on from, in the last 6 months. You can look at a time period. The default is the current, so you can see. If we looked at all, we would see everything they've ever been on, and be able to see all those discontinued medications here, so everything that they've been on. And that's kind of it by, you can also look at, sort by drug class and problem, but the default here is name, and it'll show you alphabetical by name. Next up, we have our History and Problems tab. This History and Problems tab is, again, a listing, not interactive, but a listing of their problems, their current, then it's active, acute, and chronic problems are listed here in the Problems section. You have the patient, family, and social history. So they're both their current medical problems and past medical problems here, the current surgical or active surgical and past surgical problems, and then family history, and then social history here, again for you to review. The next section of the chart we're going to discuss is the flow sheet tab. Now, flow sheets is broken up into two pieces. There's flow sheets and protocols. Flow sheets work much like clinical panels if you're used to using those in the hospital. They pull in columns of data that you can choose specific categories to categorize data. I think this is where it's going to be useful for you to look at your lab results in a columnar fashion as you're kind of used to today. So we'll cover flow sheets first. Right now we default into the flow sheets visits by time. Now you can view by problem, so if you wanted to for some reason look at only visits that happen because of a specific problem, maybe if you saw them for diabetes and you wanted to look at all the diabetes visits, you could pull in just that problem and review it. But generally speaking, I think by time will be a good place to stay. But here's where the power is. So if you want to look at, instead of visits, you can look at categories of data. So if we wanted to look at their chemistry results by time, we open up this caret here, we'll see here are all the chemistry. We also have hematology down here, so we can look at hematology and we can see all their blood counts. Much like you're used to today. So you get columns of data where you can have review information. Anytime you have a result that's out of range, it will either high or low. It does highlight it in yellow with the H and L. So it's just kind of I think probably more what you're used to seeing to review your labs than some of the other screens that we looked at. Now, if we want to go back, we know that we go back further. We default with 5 columns of data with the most recent all the way here to the right. If we want to go back further, we just use this arrow up here in the left, and it will pull in more information. Now, it'll just open it up more. So you have all of the columns still, and you can scroll down here at the bottom to see all the information, but you're opening up more up here on the left. It turns sort of a lighter gray when you're all the way back to the beginning. So here's all of the hematology tests this patient's had in the system so far. In addition to labs, you can also review other information such as your imaging. So if we look here on imaging, we can see that the patient has had some diagnostic imaging completed. You'll see that there are reports available for you to review. So you have some flexibility really on how this looks, which one you want to look at, and how it appears. The other thing that I maybe have forgotten to mention before that's kind of nice is if you do know that you're always going to want to look at chemistry, you're always going to want to see maybe imaging. If we there's the star next to it, you just select the star and then click out of it. If you look again, you'll have that appears at the top of your list. So that's how you create a favorite. So you don't have to search for the list. You can have the 2 or 3 at the top that you like to look at the best. So feel free to go and look at the different views and see how they feel for you and how it would be best for you to review the clinical information for your patient. Next up, we're going to review protocols. Now, protocols work a little bit like health maintenance does today. Every patient that you have gets associated with a wellness protocol. Now, that wellness protocol is filtered automatically by age and gender, so you don't end up with those 25-year-old male patients with the requirement to complete a DEXA scan, for instance. So for each element, you have the name of the element. You have, if there were information in the chart that we documented, so for this patient we already documented in their social history that they were a smoker, so that pulls through. It also tells us when we did that, March 30th, and that it's due again on March 30th, 2017. And we get that for each category where possible. We have tried to pull in that information. Now, sometimes you'll see that your due date is bolded. What a bold date means is that you have the ability, because we know that there's an order associated with that element, that you have the ability from this screen to directly order. So this is one of those instances in the chart where you do have the ability to interact and create create orders from just the chart rather than having to go to the Orders tab to do that. Another nice little shortcut is, so for this, say we do want to order this Snellen chart, we know that it's associated with diabetes. If I click over here on my problem list and make sure that it's green, and then I click on the due date for the Snellen chart, that means that when we do that, we have ordered the Snellen acuity that adds to our order sign list, but also that we've associated that diagnosis of diabetes with that. So it's kind of just a shortcut, so you won't have to enter that later. They're already associated, and any order that you click now, as long as diabetes is highlighted, will be associated with that. If there's an order attached and the item has already been ordered, like this fecal occult blood test, you get the indicator up here that it's ordered. This patient we've done a lot of testing with, so we have ordered a lot of things but maybe haven't really resulted them. But as soon as those results come in, they would be categorized and you would get last done and next due along with the results for that order. Just a few more things to go over here on the Protocols tab. Up here where it says Wellness, we can click here and see the different protocols that this patient has associated with them. Again, this is a test patient that's had a lot of play done with her, so she has a lot of duplicate information here. But generally speaking, we have we have 6 protocols. We have adult diabetes protocol, we have a hypertension protocol, we have a CAD protocol, COPD. Now I want to go ahead and show you how you can add a protocol to a patient. So I'm going to go out to a different patient because this one has pretty much already qualified for everyone. Back to the home screen here, and I'll go click on this Test AFP Friday. Now, the way protocols work is once you add a diagnosis that qualifies a patient for a protocol, the protocol window will populate. The Manage Protocol window will pop up and ask you to manage if you want to add the protocol. So I'm going to go here and I'm going to add the problem of CHF to this patient. Once I pick that and I save it, and I get this heart failure protocol managing provider window. So it gives me all the elements of the protocol here, and then I can either exit or save. So I want to add this protocol to my patient, so I'm going to click Save. And then once I go to my protocol window, then I have the heart failure protocol add for this patient. This wraps up the training on the patient's chart. In the next section, we'll talk about the office visit document.